All right, welcome back to How I Survived Brain Surgery. If you're new here, let's do just a very quick recap. I was on birth control for many years. It affected my period. I stopped having a period, stopped taking the birth control, period came back on, it stopped again. I was trying to figure it out why. And my gynecologist ultimately diagnosed me with a pituitary adenoma, which is a tumor in my pituitary gland. So let's continue on with the story. My gynecologist told me that I had two primary treatment options: long-term medication or surgery. Now, from there, I only told my parents and my brother because part of me was still in this kind of denial about, is this even happening? I kept imagining that my doctor was going to call me and say something like, hey, I'm so sorry about this, but I was looking at somebody else's chart when I told you that you had the brain surgery or the brain tumor and you actually don't have it. Your mind starts to go wild with all of those what ifs. So there was a part of me that was in denial that this situation was happening. And so in my mind, the more people I told, the more real it became. So I told very few people. And also, if you are going through this or you know somebody who's going through this, I highly, highly recommend do not put anything on social media as you're going through it. This was a very long process for me. I didn't say anything on social media until after I had brain surgery. And I was in recovery, but it was, I was out of the woods in terms of something bad happening. So just food for thought. Now, also, let me say, I live in the DMV area, so I knew instantly that I wanted to go to Johns Hopkins Hospital up in Baltimore. And my gynecologist recommended that I start with an endocrinologist and take it from there. An endocrinologist is, and I'm going to use some kind of medical terminology as I tell this story, but I'll try to explain it as much as I can. An endocrinologist is a doctor of the endocrine system, that is the hormone system of the body. So I went on Hopkins' website, I found one of the endocrinologists, his name is Dr. Salvatore, and I made an appointment with him. Also, let me include a timeline. I should have did that from the beginning, but March of 2023 is when I got diagnosed with the tumor, and I made the appointment for April of 2023 to go see Dr. Salvatore. Now, in the meantime, I'm a researcher at heart, so I started doing my research on how this surgery is done. And I found out the neurosurgeons at Johns Hopkins, some of them at least, have really mastered the technique called the endonasal approach, which means they go through the nose to access your pituitary gland. And when I found that out, I was shocked. But I don't really know why I was that shocked, because I know in the past, in like ancient Egypt, part of the mummification process was putting something up your nose and they can like pull your brain out. I had heard that. So the technique is not new, but it was still kind of new to me. So, I'm reading up more about it, and I said, you know what? I can handle that. Again, they don't have to remove a piece of my forehead. I won't be awake at all during the operation. I can handle that. So I told my family that if Hopkins deemed me a good candidate for surgery, I was going to go that route. And all I needed was their support. I said, do not try to talk me out of this. If you read about some case somewhere where someone had this operation and they had really bad complications, or if they didn't make it, do not tell me. I was extremely adamant about not telling me of any kind of negative cases that were out there, And I'm so grateful that they respected my wishes and my requests. So, when I told them I wanted to have surgery, of course they were shocked, as any parents and siblings, could be, but they respected it. So kudos to them. Now, April, I go and have my first appointment with Dr. Salvatore. And going into this, I just assumed that all of these doctors were also surgeons, but he is not a surgeon. He treats patients with medicine if that's the route that they want to take. And I learned that in my first appointment. So I go in, he's looking at my MRI, he's talking about the medication, all like that. and he asked me if I had any questions. And I said, would you deem me a good candidate for surgery? And he said, yeah, you'd be a good candidate. I said, that's the route I'd like to take. And the main reason that I was able to do that, because with this condition, the first treatment option is typically medication. The medication works by shrinking the tumor, and then hopefully things will kind of go back to normal. And if that doesn't work, or if you have some, bad side effects or symptoms from it, then the next order of business is typically the surgery. Also, let me put this out there. I should have said this in the beginning. I am not a medical professional. I don't work in the medical field. My background is not medicine. I have just become well versed in my condition, and I'm just sharing my story. But I do not represent Hopkins. I do not represent anybody in the medical field. So take my information with a grain of salt. This is just the patient's perspective. But he told me that typically it's the long-term medication, and then if that doesn't work, you go to surgery. Now, the reason they let me do it out of order pretty much is because the neurosurgeons at Hopkins are so incredibly talented and do this operation so frequently that they were comfortable doing this out of order. He told me if I was in a different area or maybe a rural part of the country where there's a neurosurgeon who does this maybe 5 or 10 times a year, they would absolutely not recommend me have surgery. This is something that the surgeon has to do frequently and be a master at it, basically. So thank God that I live in close proximity to Johns Hopkins. And if you're going through a situation like this and you don't live close to a neurosurgeon who specializes in this, I would highly recommend you travel for it. I know it's another layer of cost, it's another layer of logistics and planning, but if you are dealing with the brain in any way, you want to go to the best surgeon out there, the best doctors, the best everything. This is not something you want to cut corners in. Just take it from someone who has gone through it. Go to the best that you can. So, I said that I'd like to have surgery in lieu of the medication, and he said, okay, we can do that. I'd have to get put up with the neurosurgeon, and the one that I was seeing, or the one that I'm still a patient of, is Dr. Gallia. He, at least at the time, I'm pretty sure he still is, but he was the director of the Pituitary Center at Johns Hopkins, and phenomenal surgeon. I actually have 2 surgeons. I'll get into that in a little bit, but Dr. Gallia is the neurosurgeon I went to, and I could not have asked for a more talented neurosurgeon. So I called his office. I wasn't able to see him until August of 2023. So I had to go the whole summer just waiting, basically. And it was a pretty tough summer. I spent a lot of time by myself, and that was planned. I just needed time to process what was going on. And I knew that I was going to have surgery sometime in the fall or the winter. So I basically spent the majority of the year prepping myself mentally to go into surgery. And then my birthday's in the middle of the summer, spent my birthday alone, just the whole thing. So August comes, I see Dr. Gallia, finally get to meet him, and we're gonna stop there, tune in for the next part of the story.